My name's Julie Irving. I'm the Deputy Digital Programme Director from Suffolk and North East Essex ICB. And I'm here today with Gina Trimble, who is our Provider Liaison Manager, working on the Digitising Social Care Programme, where we've managed to achieve over 80% of implementation of digital social care records throughout Suffolk and North East Essex. And we've also had a bit of funding left over. So we've done a bit of care technology, AI smart lamps from Nobi. And we thought we'd do something a little bit different today. Rather than do death by PowerPoint, what we're going to do is try and showcase how we actually got involved with the care providers and pulled them along into our world of digitisation. And I'm going to ask Gina some questions about how she actually did all of this. And hopefully that'll give you a really good idea of what we've achieved and how we achieved it. So, Gina, tell us how you got started supporting our care providers in Suffolk and North East Essex.
How we got working in SNEE, ICB, was a little bit different. So our approach to work with you lovely care providers was to communicate and build a relationship with all of you and listen to what your needs are in going digital, because it's a big thing, isn't it, really, to go digital. So what we did was contacted all the care providers within Suffolk and North East Essex and speak to them and ask them what's the best way of communication. Was it either email, was it through the phone, or did they want me to actually go and visit them? So really to listen to all their needs. So that's how we did it.
But we didn't do it alone, did we, Gina? We had some help from other organisations, didn't we?
So what we did was, once we've spoken to all you lovely care providers, because we really appreciate how you work and everything, and there's no time that I'm not available for you wonderful people to ask these questions. So we gathered that information, but we also identified what your needs were. So we brought together a community of practice. So with Skills for Care to help you, support you with your applications and also your training. Because your staff, you have training needs with your staff, because if you're going from paper to digital, that's really, really difficult. So we identified that. So we brought together, as I say, community of practice with also the data protection toolkit as well. Having that understanding, and also the local authorities, so where you get your application for your funding.
So, what challenges did we face and what challenges did you face?
Well, really not the challenges, because it's all challenges for you, because it's something new that you're going through to go from paper to digital, or even if you've been using digital before, there's always challenges, there's always changes. So what we did was one of the challenges that you had was how to fill out the application, because you haven't got time throughout the day, you're not in there. The application was quite daunting, wasn't it, really, to get that completed. So what we did was, having that relationship building on trust with all you wonderful people, is we treated you all as individuals, and I would come along to you and handhold you to get through that application. So that was a challenge, but also understanding Wi-Fi. What does digital mean? What's it going to mean to your staff? How much time it's going to take up for you? And your finances. We may have been funding you, care providers by 50% for the first year, but what happens next? How's it going to enhance, and ultimately, how's it going to improve the service that you give to your wonderful people that you need to give care to? So that's how we've done it.
You were out there with those care providers. So what would you say was the best support that you gave them? What was it?
I think I covered it earlier, was really listening to all of you, having that collaborative approach, really understanding, speaking to all the assured suppliers as well, because at one stage we had assured suppliers of 27, which is really daunting when you're filling out an application as well. You're thinking, who do I go to? What do I do? Who do I start looking at? So I took that pressure away from all you wonderful care providers to actually break it down into small increments. So if it was some assured suppliers work with only domiciliary, so there was no point in the domiciliary carers looking at all the other assured suppliers, but ultimately it was your choice. So, it was, that's the way I approached it.
I know you also signposted to training opportunities and any other support that was out there.
Yeah.
And Gina's a bit modest, so I'm going to big her up on her behalf because she's not very good at that. But providers knew that they could trust Gina and that they could lean on her. This is the lady who left her mobile phone on in the evenings and said, I know you don't work regular hours, so if you've got a problem, just call me. That's the kind of woman this is. And that's the kind of thing that actually worked with our providers. And that's how we got to that over 80%, which was an incredible achievement for us. We started from less than 27% in our area, and we went to over 80%. And we did that before this year, didn't we?
We did it in
Christmas time. So we managed to get there before Christmas. So in reaching that level of adoption, what do you think was the main thing that got us there?
Trust, relationship, listening, again, just go through all of that. And I immerse myself when I go to see all you care providers, treating you all as individuals and individual needs, because you are all individuals. You all have that in different needs, each location. So what we're going to be doing as well, which I'm really excited about, is walking a mile in your shoes. So I'm going to be working with care providers from each area, so domiciliary, assisted living, etc., who's got the assured supplier on board, and work a whole shift with all of you to learn how easy it is, because there's no good me saying how easy it is to adopt and take on this transformation from being paper-based or even digital when I haven't used it myself. So it's important to me to learn from you wonderful people, and that it's built on trust. I'm very passionate about future-proofing all you wonderful people and make your life easier, and ultimately the person that needs the care, because we're all going to get old one day, and I'd like to have someone like yourselves to look after me when I get older.
So I'm going to move on, death by PowerPoint slide. Here we go. So some quotes are coming up here about what care providers have actually told us about implementing a DSCR and some of the care technology, the Nobi lights. So, Gina, in your words, what are providers telling you?
Well, really, they're telling me that it's made it easier for them, because the moment of calm, to fill out applications, to understand how digital works, they can lean in on us. So we're just nothing's too much for us. If you have a question and you feel it's a silly question, it's never a silly question. Just call us and we'll help you. And we've also built up that stronghold of relationship where it's word by mouth now, where they're speaking to their colleagues or they're speaking to someone who's based up north who wants to know about digital. So I've been contacted from everywhere, all over the United Kingdom, and asking me about it. So these are some of the actual feedback we've got, but a lot of them have said that it's improved their care, it's given them time, real time, especially with the friends and family app that's so important, to them. For the family, if I had a family member in care, the wonderful thing is I know that carers look after my family member, but to have that reassurance that you've got the friends and family app in real time, that you know what's happening, or they can contact you in real time and sit and watch, read things and write things down, or if they're drawn a picture even, and they can send that to you. But it's absolutely amazing. It's made a difference.
Thanks, Gina. So this programme isn't just about digital social care records. It's also about the care technology, and we were lucky to have some funding left over, which we spent on Nobi smart lamps for 7 of our care providers in Suffolk and North East Essex. Nobi smart lamps are part of the falls prevention agenda, so they're AI. They see when somebody has fallen, they talk to the person, they alert the care staff, and it and it's a great way of working. We're waiting on some benefits evidence to come through, some data to come through, but we're really quite excited about it. So what have the providers been telling you so far? The Grange.
Well, we've had enough funding to fund 7 actual locations, and one of them we took a risk on, which was assisted living. Is called the Grange, and they don't have many falls, but they do have learning disabilities, also people with I've forgotten now. No, mental health challenges, but also I've forgotten the name of this, but autism. But they have people who actually started falling or throw themselves, but it's made a difference to their life because they feel the feedback. They feel that their staff is not following around their residents. Their residents feel like it's their home. It's their home. So the carers don't have to follow them around. They know where the people are and they look after them, and it's preventing all of that. And it's given them a lot of information as well. Like one particular resident gets up a lot at night now, so they know when they speak to their actual GP that they can say, this person is getting up a lot at night. Is there any problem? Have they got a UTI or something like that? But it's made a real difference. But I'm most excited that it makes a real difference for you, wonderful people in care. Fortunately, at the moment, it's only for residential, but I'm really pushing for it to be in domiciliary as well, so it'll make a difference for people at home.